and welcome to the National Cancer Institute's Facebook Live. I'm Lynn Matresian. I'm the Chief Research Officer at the Pancreatic Cancer Action Network, an advocacy organization. And I'm here with Dr. Christine Alwine from the National Cancer Institute, a clinician and a researcher. Dr. Alwine, would you introduce yourself, please?
Sure. So I'm a medical oncologist and researcher here at NCI. I specialize in pancreatic cancer, and I work on immunotoxin therapies for pancreatic cancer. And I have an open clinical trial with an immunotoxin therapy right now.
So we're here today to talk about pancreatic cancer. And in particular, we're going to talk about pancreatic ductal adenocarcinoma. It's the most common kind of pancreatic cancer, and it is the deadliest of the major cancers, with a 5-year survival rate in the single digits. There are, at the moment, pancreatic cancer is the third leading cancer killer in the nation. There are more deaths from pancreatic cancer than breast cancer, and unfortunately, it's predicted that by 2020, it will surpass colorectal cancer and be second only to lung cancer in the number of deaths. So it's an important problem, and we're here to learn more about pancreatic cancer. So I'll start by asking Dr. Alwine what she would recommend if someone is newly diagnosed with pancreatic cancer.
So I think one of the most important things is to find a doctor and a care team that you're really comfortable with. People that you trust, that you feel like you can ask questions to, that can help you to come to a good decision about which way to go for treatments. And I think that a lot of times it can benefit patients to get a second opinion from someone, another doctor or a pancreatic cancer expert. And I know that a lot of patients are nervous about this because they worry about offending their doctor, but this is something that happens regularly in oncology and can really be helpful to people. The other thing is that when you're talking to your doctor and your care team about what treatments might be available for you, that you want to make sure that you don't just know what they're called and where you're supposed to show up to get them when, but you want to know what kind of benefit you should expect from them. Is this a treatment that's going to cure me? Is this a treatment that works for 30% of patients to shrink their tumor? Is this a treatment that's just going to help with my symptoms? What is it actually, the benefit that you're going to get out of it? And what are the side effects from this treatment? And how long do they last? And does it change or affect other treatments that I can get afterwards? And I think that all of those things are important questions when you're trying to figure out what to do and how to go forward with this diagnosis.
So one of the first things is, of course, having a good healthcare team. And we can help with that at the Pancreatic Cancer Action Network. I'll just add that we have a call center called Patient Central, and patients can call us, and they can ask for example, for information on how to get a second opinion from someone. We can augment the information that comes from your healthcare team. We can give information on diet and nutrition. We can give information on physicians that see a lot of pancreatic cancer, that are experts in pancreatic cancer, and can just help doing one of those most important things, which is finding the right healthcare team in order to support you through this diagnosis. So what are those treatments for pancreatic cancer?
So I think whenever you talk about treatment, you have to think about standard treatments, which are things that we have a lot of data about, that we know are of benefit to patients, that have been approved by the FDA, the Food and Drug Administration, because we know a lot about them and that they're of benefit, and that you can get at your regular doctor's office, versus treatments that are new, that we don't know as much about, and that you can only get in clinical trial. So when you're talking about standard treatments, the kind of treatment that options that are available depends on what stage of disease you have, how much disease do you have, and how well are you or how sick are you. So for patients that don't have a lot of medical problems, and their tumor is limited to the pancreas, and it hasn't spread anywhere else, and it isn't invading into big blood vessels nearby. These are patients that are potentially surgical candidates. And it's important to know whether you're a surgical candidate because surgery is the most effective treatment option that we have. So not all patients are cured by surgery, but even patients that are not cured by surgery have a better life expectancy than patients who are not able to get surgery. And the surgery for pancreatic cancer is very complicated, and it's important that when you're considering surgery that you do so with a surgeon who's experienced in doing these kinds of surgeries, because outcomes and how people do are better when you have someone who's done a lot of these very complicated surgeries. From the standpoint of patients who are not surgical candidates, whose disease has spread beyond the pancreas or who are too sick to go for surgery, and unfortunately this is most of the patients with pancreatic cancer, these are the patients that are picked up by medical oncologists like me and offered chemotherapy treatment. So chemotherapy treatment for pancreatic cancer is not curative. We give chemotherapy because it can shrink patients' tumors in some cases, it can increase their life expectancy so that they live longer, and it can improve symptoms like nausea or pain. And these things can be really important to patients. And when you're looking from beyond standard care to the clinical trial side of things, there are of course a lot more options as well.
And so thinking about clinical trials, you say that is an option for patients with pancreatic cancer. And I know we at the Pancreatic Cancer Action Network think that patients should always consider clinical trials as an option all along at any point within their treatment, because that's how we learn, that's how we get new treatments, that's how we learn how to better understand and fight this disease. So perhaps tell us a little bit more about what it's like to be on a clinical trial and how one might find a clinical trial for them.
So I couldn't agree with Lynn more that I think it's important for all patients to consider clinical trials if they have pancreatic cancer, no matter what stage of disease that they have. And I want to speak specifically as well to patients that have early stage disease and who are able to go to surgery. Understanding that 3 out of 4 patients that go to surgery will have their tumor come back within the first 5 years. And this stage of disease where you have less tumor around is one of the times when chemotherapy and other drug therapies can be most effective. And we need better treatments for this stage of disease as well as for late stage disease. And new treatments don't just appear. They have to be tested so that we know that they're better than what we have now and that they're safe. And they can't become standard treatments unless they're tested in clinical trials. And if no patients volunteer for clinical trials, then there can be no new treatments for pancreatic cancer. And I think we all know that we do need new treatments for this disease. I think one of patients' biggest concerns with coming on clinical trials is that they're worried they're going to be given a placebo or a sugar pill. And that's actually really rare in oncology trials. In early stage clinical trials, phase 1 and phase 2 trials, what we're trying to do is to figure out the best dose of a drug to give to a patient so that it's most effective. And in general, all patients on those studies get the study drug. In later stage trials, the phase 3 trials, which are the last ones before a drug is approved, what has to be shown is that the new drug is more effective than the therapy that already exists, or at least as effective as the therapy that already exists. So even if somebody is put into an arm that doesn't get the study drug, they will at least get the same treatment as what they would have had if they were not on the clinical trial. Now, all that being said, clinical trials aren't for everybody, and it's the things that you should think about when deciding whether a clinical trial is right for you is that clinical trials can take a bit more time because there can be more tests and procedures involved. And it can also require more travel because there might not be a clinical trial that's available as close to you live as your regular doctor. And these are important things to consider. And also, in some cases, there can be extra costs associated with clinical trials. And I think it's important to talk to your care team and your doctor about these things when you're considering a clinical trial to make sure that it's right for you. But it's very important that patients volunteer for clinical trials so that we can have better treatments. And I think that there's also something to be said for trying something new when you have pancreatic cancer, and we know that we can probably do better than the therapies that we have available right now.
Right. So, if I was interested in a clinical trial, how would I go about finding one?
So one thing to do is you can ask your doctor and see if there are any clinical trials that they recommend. Sometimes they will have an answer for that, and other times they really won't know because clinical trials, they open, they close, they change all the time, and it's hard to keep up with that. There are a number of resources on the web for trying to figure out what clinical trials are available. The very official site where most clinical trial data is deposited is called clinicaltrials.gov. But a lot of times it can be difficult to figure out whether the clinical trials that they're talking about are located near you or on the other side of the country. And so NCI has created the trials.cancer.gov site so it can be an easier to search database for patients that are looking for trials. And I believe that Pancreatic Cancer Action Network has a searchable database as well.
Yes, we do. So we have a database. It is at clinicaltrials.pancan.org. And patients or healthcare providers could go on and look at the pancreatic cancer clinical trials that are available in the United States, only in the United States and only pancreatic cancer, whereas the NCI site is for all cancer types.
That's right.
But this, you can put in your zip code and you can then see and say how far you would like to travel and find trials that are available. In addition, we have, again, our Patient Central Associates can help you with a trial. So if you're unsure of perhaps how to answer some of the questions, just call them. They know lots about pancreatic cancer. They can help you make sure that you understand the stage of your disease, make sure that you can find trials that would be appropriate for you. But it's clearly a very important thing to do as a pancreatic cancer patient.
And I believe that the NCI also has a telephone number that you can call, 1-800, the number 4, cancer, C-A-N-C-E-R, so that you can talk to real human beings about what might be a good clinical trial and what's available.
That's great. That's great. So what we're doing with clinical trials is trying to find new treatments, new advances, new ways of fighting this disease. So what are some of the scientific advances that you're excited about?
So I think one of the most interesting things that's coming out right now, and it's very specific to pancreatic cancer, is this issue of stromal modulation. So what is that? So pancreatic cancer, the tumors, the tumor cells are just a small part of what makes up the tumor. And there's a lot of stuff, thick, nasty stuff, all around the tumor cells, which wall them off from other places and can make it difficult to get drugs into the pancreatic cancer and cells so that it can be harder to kill. And they can also affect your immune system so it's not as strong at stopping the cancer. And so there are new drugs that are coming out that either break down or modify this stroma that surrounds the pancreatic cancer cells. One of these that is furthest along is in phase 3 trials now is the PEG-HP20 hyaluronidase inhibitor, which is now being tested in the last step before being approved by the FDA, hopefully, if it's shown to be effective, after having some nice results in earlier stage trials. But there's a number of these drugs out there that are showing promise, and it's very exciting. Another thing that I'm excited about is that there are about 10% of pancreatic cancer patients who have gene mutations in their tumor that makes it difficult for the tumor cells to repair their DNA when it's damaged. And these gene mutations, you may have heard of some of them. There are BRCA2, PALB3, things in the DNA repair pathways. And patients with those mutations have tumors that are, in general, exquisitely sensitive to a type of chemotherapy called platinum chemotherapy, and particularly when it's given in combination with a type of drugs that's not yet approved for pancreatic cancer called PARP inhibitors. And for patients with these mutations, it's important to know that you have them because it can really help your doctors direct your therapy to these treatments that have shown to be particularly effective for this group of patients. And I think the other thing that's been really exciting lately, not just in pancreatic cancer, but in oncology in general, is all of the new immune therapy agents and the immune modulatory agents. You've probably seen commercials for these, and they've been approved for a number of different tumor types because they do something that we've not really seen before in oncology, and that's, patients that have tumor that's spread beyond the site where it grew originally, patients with metastatic disease, some of them can get long-term remissions with these drugs. And like I said, that's something we've not seen before in oncology. Unfortunately, what we found is that when we give these drugs alone in pancreatic cancer, they don't have the same kind of efficacy that we've seen in other tumor types. There's an exception of about probably less than 1% of patients who have genetic mutations that make their tumor what we call microsatellite unstable, but for everyone else, these drugs by themselves don't appear to be the answer that they are in other tumor types. And so what the field has been concentrating on now is figuring out what can we combine these with so that we can get the same kind of benefit with these drugs for patients with pancreatic cancer as what we see in other tumor types. And there has been some limited successes in that regard, and there are trials of combinations with immune modulatory agents here at NCI as well as throughout the country at many centers. And I think that these are things that could be particularly interesting to patients because they do have the potential to be such game changers if we are to hit on the right combination. And I think that that's one of the things that makes them very interesting.
Oh, that's very exciting. So there are some really good ideas, scientific advances, some that have worked in other cancers, some that are really quite specific for the problems that pancreatic cancer presents. And these are being tested in clinical trials. So pancreatic cancer has been particularly hard to treat. And you mentioned the stroma and how maybe that's different from other cancers. You mentioned that immunotherapies that work in some other cancers just haven't worked by themselves in pancreatic cancer. Are these the reasons why it's been so hard to find new treatments that really work amazingly well in pancreatic cancer?
I think that that's part of it. Pancreatic cancer is a tough nut to crack. There are those aspects of the physiology of the disease that are very difficult to overcome. There's also the fact that this is a tumor that's located in some place that's really hard to get to. And when we're doing research, having pancreatic cancer tissue to work with can be harder than it is in other tumor types where it's easier to get to and the procedures to do surgery and other things are not so invasive. I think that the genetics of pancreatic cancer also make it difficult. We understand the genetics of pancreatic cancer very well, I would say, and the mutation that dominates pancreatic adenocarcinoma is what we call a mutation in the KRAS gene, and over 90% of pancreatic cancer patients have that mutation, and what we've seen is that mutation changes the metabolism, the way cancer cells eat and the way they make energy, and affects the immune system as well, and that it can make them more resistant to therapies that work with other diseases. And there's a lot of work being done now to try and figure out ways to mess up what this KRAS mutation is doing here at NCI and throughout the country. And there's a lot of research in general in pancreatic cancer right now. And I think that much of it is very promising, and I'm very hopeful that in the next few years that we have breakthroughs for patients that can produce real improvements in outcome for this disease.
Well, that's very exciting, and as you point out, there's a lot of really interesting and good research here at the National Cancer Institute and that the National Cancer Institute supports across the United States that helps us understand the molecular underpinnings of complex diseases like pancreatic cancer, and that gives us the tools that we need to approach the treatment of these diseases. So that's great. So let's talk a little bit about some of the symptoms of pancreatic cancer and what patients can do to help perhaps lessen the effect of those symptoms.
Yeah. So I think that the most common symptoms that patients have are problems with pain. And a lot of times the pain from pancreatic cancer is in the back. So organs inside don't necessarily hurt where they're located. They can hurt in funny places. And a lot of times the pain from pancreatic cancer is resistant to the usual kinds of drugs that we give for cancer. And so sometimes patients can have a procedure where you can block the pain nerves in that location to help with that. Sometimes it just is a matter of having a persistent care team that's looking for the right combination of drugs to make the pain better. Sometimes it's just getting on an effective therapy so that we can get the tumor under control. And all of those things can help with pain. Another of the big issues with pancreatic cancer is nausea and being able to eat. With a tumor that's sitting right here, right at the beginning of your digestive tract, it can sometimes be hard to eat a lot. And one of the symptoms that patients will notice even before they're diagnosed sometimes is that they don't feel like they want to eat as much as they did before. They get full very fast. And so what we recommend to people is that instead of trying to wolf down the usual 3 big meals a day, that you be in a continuous state of grazing, where you carry around something that's a very high calorie sort of snack with you all the time, and everything that you eat or drink should have calories in it. You want to do exactly the opposite of what they tell you when you're dieting. Do all the wrong things in that regard. Another thing to keep in mind is that these tumors can sometimes cause pancreatic insufficiency, or the surgery for the tumor can cause pancreatic insufficiency. And there's 2 kinds of pancreatic insufficiency. There's exocrine and endocrine pancreatic insufficiency. The one kind means that the pancreatic enzymes that you make to help you digest your food are not available to help you digest your food. And if that's the case, then you may notice that you can have bloating or abdominal discomfort after eating, or diarrhea, and symptoms like that. And if you notice those symptoms, it's important to talk to your doctor about them, because you can be prescribed replacement enzymes that you take with your meals that replace what your pancreas usually makes. And those enzymes really don't have other side effects. In fact, they don't even live very long in the body. You have to take them right when you eat. They help you digest your food, and then things move on. The other kind of pancreatic insufficiency, the endocrine pancreatic insufficiency, means that your pancreas can't make enough insulin, and it can cause diabetes. And there are some patients with pancreatic cancer who get diabetes because of their tumor. There are some patients that get diabetes because of their surgery for their tumor. And then there are some patients that have had diabetes for a long time that we know are at greater risk for having pancreas cancer. And so that's another condition that's woven very closely with pancreatic cancer that research is looking to understand more about. And I think one of the other big symptoms of pancreatic cancer is this issue with losing weight that we call cachexia, when you lose enough weight and enough muscle mass. And we think that this is caused by hormones that the pancreatic cancer makes that changes the way your body metabolizes the food that you eat, in addition to being able to eat less. And there's a lot of work going into understanding this as well, which appears to be a phenomenon that we see in other cancers, but seems to be particularly augmented in pancreatic cancer.
Yes, I mean, I think this is something that we hear about often. The pancreas is a digestive organ, and so when you have cancer in the pancreas, that the ability to digest your food and the ability to regulate your sugar levels are all impacted by this. And so we find that's a very common problem. You give excellent advice on how to handle that. If you want a little more information, you can also, again, go to the Pancreatic Cancer Action Network at pancan.org. You'll find a phone number there. You'll find an email address there. And you can ask for our diet and nutrition book. And so we can send you a nice little booklet that will help with some of those helpful hints, the kind of things that are easier to digest, and that will give you the energy that you need when facing this disease. So that would be one way. There's also a very good call center cancer information from the National Cancer Institute as well.
So the 1-800-4 cancer, CANCER, if you're looking for help.
Yeah, so they can help, and again, our Patient Central associates can help answer lots of questions. We also have a caregiver and patient survivor network. So if you want somebody to talk to that has been through a similar situation, for either caregivers or for patients themselves, again, you can call us, get information, and we can give you the phone number of someone that you can call to help you.
And that can be something that's very important to a lot of people, to know that there are others like that have been in the same situation that they are in, and to hear their stories and how they got through things. And it's important to know that you're not alone, and that there's resources available to help through something even this difficult.
And so thank you so much for joining us. We hope we have given you some helpful information. Thank you for joining the National Cancer Institute's Facebook Live.